Hi everyone, I'm Dr. Tirta Wijaya. Welcome back to my channel where we will talk about various health matters. Today, we will talk about a highly contagious virus that is a known cause of several types of cancers, how it spreads, and how to prevent it. This topic was brought to my attention because many of you asked whether this virus can be spread via contaminated public toilets. Without further ado, let me introduce you to HPV, Human Papillomavirus. This virus is from Papillomaviride family. Currently, over 200 types of HPV have been fully characterized and predominantly assigned to three genera: alpha papillomavirus, beta papillomavirus, and gamma papillomavirus. Among 65 HPV types belonging to alpha papillomavirus, 12 types are considered oncogenic and associated with the development of cervical cancer and its precursor lesions. Another classification of HPV is based on the infection sites. Most HPV can live only in the certain cells called squamous epithelial cells. These are normal cells found on the surface of the skin, called cutaneous, and on the moist surfaces and membranes, called mucosal membranes. Some cervical cancers come from HPV infection of glandular cells in the cervix and are called adenocarcinomas. Many HPV are cutaneous types, meaning they invade and live in cells on the skin, causing warts on top of the skin in areas such as hands, feet, arms, and legs. They are not the same as genital warts. Mucosal HPV types invade and live in cells on mucosal surfaces. Mucosal membranes are moist surface layers that line organs and parts of the body that opens to the outside, such as vagina, anus, cervix, and vulva. Vulva is the area around the outside of the vagina. Then inner foreskin and urethra of the penis. Then inner mouth, nose, and throat, the inner part. Then trachea, which is the windpipe, and bronchi, smaller breathing tubes branching off from the trachea. And inner eyelids, the inner part. Mucosal HPV types are further broken down into low risk and high risk types, depending on their ability to cause cancer. High risk HPV can cause several types of cancers. There are 12 high risk HPV types from the alpha papillomavirus genera, namely HPV 16, 18, 31, 33, 45, 52, 58, and the others, total 12. HPV 16 and 18 are responsible for most HPV-related cancers. Low-risk HPV types, for example HPV 6 and 11, rarely cause cancers, but some of them can cause warts on or around the genital, anus, mouth, or throat. When the warts develop in a respiratory tract, it is called respiratory papillomatosis, which can cause breathing problem. HPV is a circular double-stranded DNA virus located in a non-enveloped icosahedral capsid that is about 52 to 55 nanometer in diameter. To put these numbers into perspective, HIV diameter is around 100 to 120 nanometer. Human sperm is around 3 to 5 micrometer, and condom pore diameter is around 2 to 7 micrometer, depending on type and conditions. Kindly note that 1 micrometer is 1,000 nanometer, and 1 millimeter is 1,000 micrometer. HPV infection is a very common sexually transmitted disease. It can spread through vaginal, anal, or oral sex. Almost everyone becomes infected with HPV within months after becoming sexually active, and half of these infections are with a high-risk HPV type. Most HPV infections are self-limiting, many even asymptomatic, where our immune system can control and clear the infection within a year or two. But sometimes the infection persists for many years, defeating our immune system and invading our body, causing cell changes that become precancerous, then cancerous if left untreated. Types of cancers caused by HPV. Number one, the most common one is cervical cancer. Almost all cervical cancer is caused by HPV, with HPV type 16 and 18 dominating it. Then vaginal cancer, where about 75% is caused by HPV. Then vulvar cancer, about 69% is caused by HPV. Number 4 is oropharyngeal or throat cancer. About 70% is caused by HPV. The characteristic of oropharyngeal cancer is different from oral cavity cancer. Number 5 is anal cancer, where over 90% is caused by HPV. Then penile cancer, where about 63% is caused by HPV. Next, we will talk about the transmission and prevention of HPV infection. If you like this kind of information and think it is useful, please like this video and subscribe to this channel so you can continue to receive similar information. If you think this topic is beneficial to someone, please feel free to share this video to that person and be a blessing. Host of HPV is human only. Papillomaviruses are completely species-specific. Infectious cells can be transmitted through direct virus and cell contact through intimate skin-to-skin contact, including vaginal penile sex, penile anal sex, penile oral sex, and vaginal oral sex. The main way the mucosal types of HPV are spread is through sexual activities. It is not spread through blood or body fluids like HIV or hepatitis B virus. HPV infections are more likely in people who have had more than one sex partners. Correctly using condom can lower the chance of HPV transmission but does not prevent it completely. The HPV subtypes which cause cutaneous verrucae are spread by contact between skin with microscopic or macroscopic epidermal damage and a fomite harboring HPV. In rare cases, mothers can infect their newborns through vertical transmission. HPV, however, is not spread through toilet seats, hugging or holding hands, swimming pools or hot tubs, sharing food or utensils. Incubation period of HPV can vary from 1 month to several years depending on many factors, but it is usually between 3 weeks to 8 months, and most warts develop in 2 to 3 months after infections. However, most cases of infections will never show any symptoms. Visible presence of genital warts can increase chances of infection dramatically, as 65% of people who have come in contact with the warts will develop them as well. Diagnosis varies depending on body site and disease manifestation. Mucus type HPV tend to be more related to sexual activities, while cutaneous type HPV lean to general contacts and hygiene habits. So, for cutaneous warts, doctor may ask, do you wear proper footwear when showering at the gym? While for the genital warts, the questions are more like, when was your last unprotected sex? Or do any of your sexual partners have genital warts or history of HPV? Or are you HIV positive, etc.? Doctor will need to know the history of prior vaccination, previous pap smear or HPV test results, and sexually transmitted infections, among many other informations. Physical examination varies too. For cutaneous warts, doctor will check hands and feet thoroughly, including between the digits and the underside of the toes. For anogenital warts, doctor will check the anogenital region. Patient may require a speculum examination of the anus, And men may require an examination of the urethra depending on sign and symptoms. And depending on the history of sexual practices, an oropharyngeal examination may be prudent. Women may need speculum examination of the vaginal wall and cervix. Depending on patient age and history, an initial or repeat pap smear may be necessary. HPV is resistant to antiviral agents. There is no complete cure to date, and chances of recurrence are high. Individuals with cutaneous warts have numerous treatment options available, including surgical removal, cryotherapy, it means freezing of the infected tissue, then irritant or immunomodulating medications like imiquimod and laser removal. Many of these treatments' purpose is to manually or chemically irritate the area, thereby invoking a host immune response to assist in clearing the infected tissue. Topical treatment using tricloacetic acid, ammonium trichlorotellurate, and podophyllin on external vulval and perianal warts has been found to be effective with low recurrence rate. Anogenital and oropharyngeal warts may be treated similarly to cutaneous warts as long as the patient is immunocompetent. Development of HPV-related carcinoma at these sites may require resection, chemotherapy, and/or radiation. Cervical HPV-driven lesions may regress without any intervention. Young immunocompetent women with dysplasia are usually monitored at shortened intervals through pap smears or colposcopic examination. Persistent cervical dysplasia at any age or high-grade dysplasia in older women is treated with cryotherapy, loop electrosurgical excision procedure, or cold knife cone excision to resect the cervical lesion and the transformation zone. If the patient progresses to malignancy, like becoming squamous cell carcinoma or endocervical adenocarcinoma, further resection, chemotherapy, and or radiation may be required. HPV is resistant to heat and drying and is able to survive in inanimate objects such as clothing, socks, sex toys, and laboratory equipment that have come in contact with infected patients. That is why HPV is commonly found in environment. But even so, allow me to repeat that HPV up to now is not known to spread through toilet seats, hugging or holding hands, swimming pool or hot tubs, or sharing food or utensils. Disinfectants effective for HPV are exposure to 90% ethanol for at least 1 minute. Please note that hand sanitizer with 70% alcohol is not effective. Number 2, 2% glutaraldehyde and 30% Savlon or 1% sodium hypochlorite. We can also inactivate HPV physically. Physical inactivation of HPV varies with different strains, but most can be inactivated by ultraviolet irradiation or heating to 100 degrees Celsius. Screening and prevention varies too. Since cutaneous type of HPV are commonly found in the environment and can be controlled and cleared by our immune system, the rational prevention is personal hygiene and healthy lifestyle to support our immune system by cleaning our hands and feet and other parts of our skin with soap and water. Number 2, taking care of wounds properly to prevent infection. So we need to cover open wounds. Number 3, avoid prolonged contact with infected clothes, socks, sex toys, etc. Number 4, routine moderate intensity exercise at least 150 minutes per week. Number 5, consume healthy balanced diet. And number 6, getting good quality sleep adequately. Number 7, avoid smoke, either as active or passive smokers. Then avoid alcohol and excessive sun exposure. As for mucosal types of HPV, which are sexually transmitted, in addition to the healthy lifestyle I mentioned before, the prevention is safe sexual habit like A. Abstinence. It means to abstain from risky sexual activity, including vaginal, anal, or oral sex. B. Be faithful. It means to have sexual relationship with only one person who is also having sexual relationship with only one. In other words, exclusive monogamy. C is for condom. Even though condom is not 100% effective in preventing HPV infections, many studies prove that it is much better compared to no condom, compared to unprotected intercourse. D is for do vaccinations to prevent up to 90% of cancers caused by HPV infections and genital warts. Some HPV vaccines can prevent infection with HPV 16 and 18 only. These are the high-risk types that causes most cancers compared to other strains. Other HPV vaccines protecting from 9 strains of HPV, including the 7 types that cause most HPV-related cancers, type 16, 18, 31, 33, 45, 52, and 58, and the 2 low-risk types that cause most genital warts, type 6 and 11. They are approved for use in males and females, mainly boys and girls, to prevent HPV infection. Vaccines do not treat existing infections. Vaccination protects young people from the most common mucosal HPV types that can cause genital warts and cancer later in life. Ideally, HPV vaccines should be given to boys and girls between the age of 9 and 12 before they are sexually active. Teens and young adult age 13 to 26 years who have not been vaccinated or who have not received all of their shots should get the vaccine as soon as possible. Vaccination of young adults will not prevent as many cancers as children vaccination. Adult age 27 to 45 can still be vaccinated, but they are less likely to benefit as much as the younger cohort, simply because they have probably been exposed to HPV. That is my sharing about HPV for today. I hope you found this information useful. If you did, please give this video a like and subscribe to my channel so you can stay updated with more health tips and information. If you have any health-related questions or topics you'd like me to cover in future videos, feel free to write them in the comment section below. However, just a friendly reminder, I can't provide personal medical consultation here. It is always best to discuss your individual condition directly with your doctor. Thank you for watching and supporting this channel. See you in